Orthodontic appliances. Orthodontic appliances are devices or appliances create orthodontic force and transmitted the orthodontic force to a single tooth or multiple teeth or group of teeth, or transmit the orthodontic force to the maxilla or the mandible and the alveolar bone of the maxilla or the mandible to produce change in the position of the teeth, or change the position of the malaligned teeth, or to change the malaligned teeth to well-aligned teeth. And also the orthodontic appliance produce the orthodontic force to produce a skeletal changes in the skeletal pattern, which are the class 2 or class 3, to provide the treatment goals, which are the aesthetic, functional efficiency, and structural balance. The orthodontic appliances are divided into the activity of the appliance into an passive orthodontic appliance and active orthodontic appliance. The passive orthodontic appliance not apply any orthodontic force and used to prevent malocclusion or breaking the habits or maintaining the spaces. The active orthodontic appliance is provide an orthodontic force or apply orthodontic force to move the teeth or the skeletal structure. The passive appliance include the habit breakers, space maintainers, and retainers. The habit breakers, it's removable or fixed orthodontic appliance used to prevent the bad oral habits such as thumb sucking, nail biting, mouth breathing. The space maintainers are also a removable or fixed appliance used to maintain the position of the teeth when there is a premature loss of the primary teeth. The retainers are also removable or fixed appliance used to retain the teeth after the active orthodontic movement or at the end of the active movement of the teeth. The active appliance are either fixed orthodontic appliance or removable orthodontic appliance or myofunctional appliance or a combination of fixed and removable. Also, the myofunctional appliance may be fixed or removable or combination between the fixed and removable orthodontic appliance. The ideal requirement for any orthodontic appliance should be biologically tolerable by the oral tissue. That means not cause any irritation to the mucosa or any adverse effect to the teeth, such as increase in the mobility, sensitivity of the pulp of the tooth, pulpitis. Also not interfere with the normal function of the oral cavity and not interfere in adverse effect with the growth of the maxilla and the mandible. Also, one of the important requirement of the orthodontic appliance is the mechanical activities. That means the appliance should provide a controlled orthodontic force that provide the attenuated orthodontic tooth movement. Also should be an aesthetic and acceptable by the patient to provide good compliance by the patient and good cooperation. The removable appliances are removed and reinserted by the patient, so it is called removable, and also can be removed and adjusted by the dentist or orthodontist and inserted intraorally. Most mainly used in the upper arch and also could be used in the lower arch. The mode of action of removable orthodontic appliance, it mainly provide a tipping movement That means the removable appliance is provide a point of force application to the crown and tipping of the crown only. Also, the removable appliance it provide a rotation less than 90 degree and and blocking or induce the eruption of the teeth or as a guidance for eruption of teeth. The advantage of removable appliance first is removed by the patient, so it's need for highly compliant or highly cooperative patient. Provide simple tooth movement, which include the tipping, rotation less than 90 degree, intrusion, extrusion, guidance for the growth of the mandible and such deficient mandible or prevent the prognathic maxilla from growth forward. Easy to make and adjust by the dentist. Also, the socially sensitive cases, the patient can remove the appliance from the oral cavity, and also the removable appliance is less chair side time and opposite to the fixed appliance which need for more time in the clinic for fixing and for adjustment. The removable appliance need less time in the clinic for adjustment and work. It is cheap and less expensive in comparison with the fixed orthodontic appliance, and good oral hygiene maintenance or easy oral hygiene maintenance because the appliance can be removed extraorally and cleaned and then reinserted intraorally. The disadvantage of the orthodontic appliance is totally cooperative dependent. That means it need for highly cooperative patient or highly compliance patient because it should be inserted and removed by the patient and depend on the patient himself. Also, uh, limited movement can be achieved by removable appliance because it's only provide a tipping movement of single or two or three teeth and rotation and minor intrusion and extrusion, while the fixed appliance can provide more complex movements such as bodily movement, torquing movement, and multiple teeth can be moved by the fixed appliance. Uncomfortable because of the large base plate of the appliance that maybe prevent the phonetic of the patient and increase the salivation. Easily to broken and damage during the handling of the component of the removable orthodontic appliance are four components which include the active component, retentive component, acrylic base plate, and anchorage. The active component of the removable appliance is that part of the removable orthodontic appliance that produce the orthodontic force for the tooth movement, while the retentive component are the parts of the removable orthodontic appliance that used to hold the appliance intraorally, and the acrylic base plate regard as the major connector connecting the active component and retentive component of the appliance and act as a part that provide the anchorage of the removable orthodontic appliance by preventing the unwanted tooth movement. The anchorage is regarded as an imaginary component of the removable orthodontic appliance that prevent the unwanted tooth movement, and it's produced by one full extension of the acrylic base plate to engage many teeth, and uh, adaptation of the retentive components such as the Adams clasp and or fitted labial arch to the acrylic base plate and the teeth. The active component include the springs, the screws, elastics, and the springs is divided according to the movement into the labial and buccal movement, such as the Z spring, recurve Z spring, T spring. Other, other type of active component are the palatal or the spring that produce palatal tooth movement or lingual tooth movement, which include the Hawley arch, Robert retractor. The springs that produce mesiodistal movement or distomesial movement include the finger spring, buccal canine retractor, and other spring of the active component that produce a combination of movement or derotation, the rotated teeth less than 90 degree, which include the labial force by the Z spring or recurve Z spring, and the palatal force, which is the Hawley arch that produce an opposite tooth force, opposite force in opposite direction, and the same amount that produce the rotation of the rotated. This is an example of the active component. This is the Z spring, which produce the labial tooth movement, and the finger spring that produce mesial or distal tooth movement, and the buccal canine retractor that produce distal movement of the canine or retraction of the canine distally. The expansion screw is another type of the active component of the removable orthodontic appliance. For example, the jack screw that can inserted in the acrylic base plate by dividing the acrylic base plate into two parts, and the two parts are joined by the screw or the expansion screw or jack screw that produce a lateral movement of the buccal segment of the arch and produce expansion of the arch in cases of the posterior crossbite. Also, the expansion screw or the jack screw produce distalization of the molar by opening the screw and moving the two molar, the distal and expansion this arch mesiodistally or increase the length of the arch. The retentive component of the removable orthodontic appliance are the parts of the removable appliance that retain the appliance intraorally, and its many types. The most popular or famous type of the retentive component is the Adams clasp and the C clasp, and anteriorly the fitted labial arch and the Hawley arch. Other miscellaneous types of the retentive component or rare case of the retentive component are the ball-ended clasp, as in this picture. The fourth component of the removable orthodontic appliance is the acrylic base plate. The acrylic base plate is the part of the removable appliance or the major connector of the removable orthodontic appliance that connect the retentive part of the removable appliance and the active part or the active component of the removable appliance, and it's have a 2 to 3 millimeter thickness with different colors and fabricated from self-curing acrylic or hot curing acrylic. The function of the acrylic base plate is to stabilize the other component of the removable appliance, stabilize the retentive and active component. Also protect the spring by boxing or protect the Z spring, for example, from damage during the normal function of the oral cavity. The base plate also provide an anchorage for the appliance, which prevent the unwanted tooth movement by close fitting of the acrylic base plate around the neck of the teeth, and provide anchorage for the movement of the teeth by adaptation to the mucosa of the vault of the palate. The acrylic base plate also acts as an active component by adding a modification for the acrylic base plate, and these modifications include anterior bite plane and posterior bite plane. The anterior bite plane include the increased extension of the acrylic base plate anteriorly between the maxillary and mandibular incisors, and the increase in the thickness of acrylic behind the upper incisor to form a bite plane that prevent the eruption of the mandibular incisor and free the space between the mandibular and maxillary posterior teeth to give a chance for the eruption of the posterior teeth and opening the bite anteriorly. So the anterior bite plane used to treatment of the deep overbite. The posterior bite plane include the extension of the acrylic base plate posteriorly to cover the occlusal part of the posterior teeth to free the space anteriorly between the anterior teeth to give a space in the occlusion for the correction of the anterior crossbite case.